Hi there. I'm Dr. Kelsey Lee. I am a physician here at the Medical Group Clinic here in Philly. I'm giving a presentation today called Love Your Heart, Simple Steps to Wellness. Throughout time, we humans have had many ideas about what the heart means to us. Ancient China referred to the heart as the seat of intelligence and mind. In ancient India, they talked about the heart as the home of oneself, a sort of link between heaven and earth. Ancient Greeks thought of the heart as a source of emotions. One famous Greek philosopher, Aristotle, said that the heart is the place where life fails last of all. In our modern view, the heart is both a physiologic heart that helps keep us alive, as well as a symbolic heart, kind of a center for our emotions, desires, and connections. Today we are focusing on the physiologic heart. Essentially, the heart is a strong muscle that pumps blood and nutrients to all the organs and tissues. Heart and vessel disease, or cardiovascular disease, can take a few different forms. It can look like plaque in the blood vessels that lead to the heart, so coronary heart disease can be a stroke, heart failure, high blood pressure, arrhythmia, valve disease, or peripheral vascular disease. Unhealthy hearts and vessels, or cardiovascular disease, it is the leading cause of death in the U.S. It killed nearly 1 million people in 2022, which was more deaths than cancer and chronic respiratory disease combined. Not only is it deadly, but it is expensive. So from 2017 to 2020, we spent about $417 billion to care for some form of cardiovascular disease. We do see higher rates in non-Hispanic Black men and women, and we also see higher rates in rural residents, which is about 20% of the U.S. population, and yet we're seeing a 40% higher prevalence of cardiovascular death and then higher death rates from that cardiovascular disease. So how do we prevent cardiovascular disease? We put a lot of money and resources towards answering this question. The American Heart Association has organized an accumulation of these findings and organized them as the Life's Essential 8. So Life's Essential 8 are basically 8 factors that when you optimize, you greatly reduce your risk of heart and vessel disease. So today we'll be working through them kind of one by one, and you'll see on your handout there's a little kind of ditzel about each of them. So first is eating better. Simple and easy, right? Maybe not. This next slide is a little busy, but stay with me. Eating better is a conglomerate of skills, habits, and eating choices. So what kind of skills, what kind of habits, what kind of foods? One skill is reading nutrition labels. Now studies are mixed about how often we actually do this and understand what we're looking at. But it is clear that those who do read the labels and understand what they're looking at tend to make better, healthier habits. One might be better fiber intake. Another skill is cooking at home. We, over the years, have relied more and more on food that has been prepared outside of the home. This has been regularly increasing since about the 1970s. And then in 2023, it did surpass the amount of money that we spent on food outside of the home compared to what we spent on food inside of the home. Part of this may be inflation, but it is a trend that's been going on for a while. Unfortunately, as we have shifted towards convenience, it has been somewhat at the cost of our body's health. So what kind of habits? So things that you've heard before, watching portions, eating regular meals and not frequent snacking, trying to avoid eating late into the night when you can, are all habits that can be associated with maintaining a healthy weight. And then as far as what types of foods, in general, when you're choosing between foods, you want to choose the item with the lower sodium, lower saturated fat, and lower added sugars. I've got a table here, green, yellow, red. So green are the foods that you can enjoy in as much fashion as you like. So it's fruits, vegetables, whole grains that contain fibers, beans, legumes, nuts, which are all examples of plant-based proteins, and then lean animal proteins. So that's going to be your chicken, fish, seafood. Food that you should limit as much as you can, which is kind of in that yellow range, something that maybe is more of a treat, maybe once or twice a week or once or twice a month, depending on the food item. These are sweetened drinks, alcohol, sodium, red and processed meats, refined carbohydrates, so stuff with added sugars, processed grains, full fat dairy, and highly processed foods. The ones you want to avoid completely are your trans fats, which come from a lot of partially hydrogenated oils. So this is like your fried foods. That's part of the reason why they're really bad for you. They do taste good, but they're not good for you. And then other commercial baked goods. Sometimes you'll see this in donuts, cakes, pies, crusts. There's a few different items that have been that have come out that don't have this. So you do want to like look at the nutrition labels because then you can choose between different items. So. All right, and then just remember, eating better is about improvement, not perfection. Now, some people, they like to have a general guide. Other people want a more structured diet plan. And they have looked at several structured diet plans that are helpful in lowering the rates of fatal and non-fatal heart injury. Mediterranean diet and the DASH diet both come to mind as ones. The MyPlate method is a tool that's come out for kind of a heart-healthy diet in order to help kind of guide you as well with your eating. And that's pictured there on the right. You'll see kind of a round plate there, cut in half with non-starchy vegetables and some fruit there on the left. And then the right side is further cut in half, indicating the portion of protein you're looking for, and then your whole grains, starchy vegetables, and legumes in that last component. Feel free to talk to your doctor about any foods that you should emphasize or avoid given your personal health history. This information may need to be more refined if you have cardiovascular disease already, and if you have something like diabetes or gout, diverticulosis or kidney stones. Some of that may change some of these recommendations. And then if you're having any difficulty accomplishing your dietary goals, see our dietitian. Move more is the next life's essential. The current recommendation is to move 150 minutes or more of moderate aerobic activity weekly with resistance weight training at least twice weekly. We know that 150 minutes is good, 200 minutes is even better, and 300 minutes weekly is even better than that. So it's a good goal. Now, if you're not at that point, the goal is really to start slow, do what you can, and then just move right along until you're able to get to that point. Now, children need at least 60 minutes of physical activity daily, which is even more weekly. People do tend to have more success with this when they start with realistic goals, increase with time, and then really structure this into their day so that it's a daily habit. So if it hurts to move, what do you do? So my advice here is to start slow and avoid overdoing a new exercise. So instead of going like 110% on day one and then being so sore for the next 3 or 4 days you do nothing, do something like 50 to 60% of your usual effort so that you can do that day after day. You can always increase it as you move along, as you get more comfortable. Certain exercises do tend to be a little bit easier on the joints, things like stationary bicycling, elliptical usage, aquatic exercises, and seated exercise, such as chair yoga, can be a great place to start if you notice a lot of pain with movements. You can also keep the joints and muscles about 20 minutes before exercise. Start with range of motion exercises and stretching for 10 minutes. Go slow and take breaks, and ice afterwards. Now, feel free to talk to your doctor if there's any exercises that they would again emphasize or recommend avoiding entirely based on your personal health history. And if you're having difficulty accomplishing your goals, there's physical trainers and exercise therapists that can help with this. Next is quit tobacco. So tobacco use is the #1 preventable cause of death in the U.S. It includes about 1/3 of all heart disease. Even within a year of quitting, there is a 50% reduction in the risk of heart disease. If you smoke, then consider why you smoke. A lot of people do it for different reasons. They do it out of habit, boredom, addiction, relieving stress. So you want to make a plan specific to the reasons why you smoke or why you smoke that particular cigarette. And make a plan to quit. If you're having trouble, then consider your resources. The Quit Line is a great resource. Asking your doctor about medications that have come out that's helpful with quitting. And then you can also consider a therapist who does cognitive behavioral therapy or mindfulness-based interventions, because these also have evidence with helping people quit tobacco use. Next is getting sleep. Both sleep quality and quantity are important. They both, if you can optimize on both, then you get good sleep. Good sleep helps with memory, problem solving, attention, creativity. It helps heal your vessels and cells. So poor sleep does the opposite, and that includes cardiovascular disease, things like high blood pressure, and it's higher risk for diabetes as well. Sleep quantity requires you to get to sleep, stay asleep, and to sleep long enough. Insomnia is just meaning that some form of not being able to sleep varies in terms of why it's happening, and then treatment really needs to be geared towards the underlying problem. Now, some of those treatments might include sleep hygiene counseling or cognitive behavioral therapy or even medications. Some simple tips to help with sleep is avoiding screen time before bed. This inhibits your natural melatonin, which that's your normal drowsiness hormone. So if you can keep that up high when you're ready to go to sleep, it'll be easier to fall asleep. And then you also want to avoid alcohol before bed. It can be sedating initially, which is why it kind of gains popularity with that, but it does suppress the deep stages of sleep, so you get less restorative sleep, so you end up being more tired despite having used that. Now, some people, they'll get the quantity of sleep, but the quality of sleep is what's lacking. A big contributor here in the US is obstructive sleep apnea. Obstructive sleep apnea can increase the risk of heart failure by 140%, stroke by 60%, heart disease by 30%, and untreated sleep apnea is 2 times more likely to have a heart attack than someone without sleep apnea. So it can have a lot of implications on your health. Treatment can be CPAP, weight loss, dental device. So talk to your doctor if you have difficulty sleeping. Next is managing weight. Our current weight definitions are based on BMI. This is it's weight over height squared. So essentially, the more weight you have with respect to the height, then the extra non-lean mass that's on your body. Normal is anywhere from 18.5 to 24.9. Overweight is 25 or more, which is about 30% of the US. And a BMI of 30 or more is obesity, which affects about 42% of adults. So it is very common in our society. So extra weight often is associated with low-grade chronic systemic inflammation that can have metabolic and endothelial dysfunction. So essentially, it's all the tiny little cornerstones that end up leading to the cardiovascular disease that we see. Something that's important to note is that sometimes people have a normal BMI, but they have a high waist circumference, which is important to note because you can still see those high risks of cardiovascular death and high mortality. So there's, BMI is not perfect. There's other elements to this, but it's good to keep that in mind. Clinically significant weight loss does not necessarily mean you get down to a normal BMI. Because we see improvements in cardiovascular markers, so like blood tests, and we can see that with as little as 5 to 10% body weight loss. Greater loss generally yields more benefit, and it can be achieved with lifestyle changes, medicines, or surgery. We know that weight loss can reduce both fatal and non-fatal cardiovascular events. So if you have difficulty losing weight, talk to your doctor. Next essential is controlling cholesterol. So cholesterol is mostly made up by your liver. Some of it comes from just directly from what you're consuming, but a lot of it comes from the liver. And your liver makes this cholesterol based on the foods that you eat. It makes good cholesterol and it makes bad cholesterol. So good cholesterol is good because it's protective. It improves your blood vessel health, reduces inflammation and antioxidants, or contains antioxidants. And then bad cholesterol, the LDL, that's what contributes to atherosclerosis, which is that plaque buildup leading to heart attacks and strokes. Saturated fat and trans fat in diet tend to stimulate your liver to make the bad stuff, so you want to try to avoid those. What about eggs? Has anyone heard eggs are bad? So eggs contain cholesterol. So for a long time we felt if you ate cholesterol that you would get high cholesterol, which led to the idea of like eggs are bad. However, we found that most of your cholesterol is made by your liver, not what you're directly eating. It's some, but not near as much. So really, you want to target more of the saturated fat in your diet and trans fat, not necessarily the cholesterol in eggs. They did do a Harvard research study that looked at eating a single egg daily for a duration of time. It did not increase the risk of cardiovascular events because it didn't stimulate the liver to make a bunch of LDL, essentially. So feel free that you can eat an egg. So There are other breakfast items you want to be cautious of because of the saturated fat. So butter, sausage, bacon, full-fat cheese, muffins, scones, all have quite a bit of saturated fat, and that's more of your culprit in the breakfast world rather than an egg.
But that's what's good.
Other breakfast items to avoid are your processed carbohydrates, so like white bread, pastries, hash browns, that kind of thing. So controlling cholesterol you can do with a combination of low-fat diet, kind of favoring the unsaturated fats over the saturated, fiber, physical activity, and medications. So you might have heard like Cheerios are good for cholesterol. The reason they say that is because it's got some fiber in it, and so fiber does reduce some of the cholesterol absorption when you eat it. It's not huge, but it's there, so it does technically help. But your main target, if you're wanting to target this, is your saturated fats and your trans fats. Now everyone has, or not everyone, but a lot of people can have a different goal number for cholesterol, and it's determined by your personal health history. Someone who's had a heart attack before, someone who has diabetes, someone who hasn't had any of those things, may have a different goal number for cholesterol than another person. So if you don't know what your goal number is, just ask your doctor. All right, next is managing blood sugar. So the food you eat, it's broken down into blood glucose and floats around until your pancreas puts out enough insulin so that the glucose can be then put into the cells. They then, they do different things the different cells do with the energy, but it does require that insulin to do so. People with type 2 diabetes have a resistance to insulin, so there's too much glucose that stays in the bloodstream instead of getting into the cells. When that happens, then that glucose floating around accelerates atherosclerosis, or that plaque buildup. And then that's what leads to heart attacks and strokes. It can also lead to chronic kidney disease, neuropathy, and vision loss. So actually diabetes is the #1 preventable cause of amputations in the US and blindness in the US. So the long story short is like know your blood glucose. This might be something that your doctor periodically measures for you at your wellness checkups, or this might be something that you personally check yourself on a daily basis, depending on your medical history. Treatment is diet, exercise, medicines, weight loss surgery for those that qualify. So there's a few options for treatment. Next, for anyone still awake, the 8th and final life's essential is managing blood pressure. So blood pressure is the force that your blood exerts on the vessel wall. When the pressures are too high, this leads to plaque buildup on the vessel walls. It'll weaken your heart muscle and then damage the vessel wall lining. So you can find out your blood pressure or what it tends to run at the doctor's office, or you can buy a cuff to measure at home. If the levels are consistently high, then generally we'll recommend treatment, and that can be diet, exercise, medications, and smoking cessation can be a big important thing for controlled blood pressure. So a common blood pressure goal is less than 140 over less than 90, because this has been, we see less death with that basically in studies. So 140 over 90 for many people is the goal, but depending on your medical history, your specific goal might be different. So if you're not sure what your goal should be, then you can talk to your doctor. I do have one bonus essential that's not in the essential 8. It's mental health. And it is a good one. We see that mental health disease can contribute to getting that first heart attack and can be a higher risk after you've had a heart attack. So you'll see depression about 3 times more likely after a heart attack, for example. And treatment, it revolves around counseling, therapy, exercise, and medication. So don't forget to discount this as a priority for cardiovascular health. So this is the summary slide. You'll see the 8, essential 8 in our bonus one. So eat better, move more, quit tobacco, get sleep, manage weight, control cholesterol, manage blood sugar, manage blood pressure, and keep an eye on that mental health. All right, that's all I got for you guys today. Do you have any questions? Go for it.
The DASH diet.
Yeah, so DASH diet, I can go back to it too here. Here we go. So dietary approaches to stop hypertension is the DASH diet. And what it's essentially looking at is trying to reduce your sodium intake because as you reduce sodium intake, a lot of high blood pressure can improve. And so this is a targeted approach focusing mostly on that. What other questions?
I think I figured out what the problem with my weight is. I'm too short.
It's a math problem, you're right. Very good. Go ahead.
Yes, I'm on medication for AFib,
Sure.
and I was wondering, could stress or pain cause AFib?
Sure. So there is a higher risk of atrial fibrillation with chronic stress. And we see that better stress levels tend to have less kind of flares of the atrial fibrillation where you're having like elevated RVR and high heart rates. So there is a relationship there. It's not entirely causal, meaning that it's not, oh yeah, you got AFib, you must have been pretty stressed, you know. But they do see a relationship with control. Yeah, good question. Go for it.
What do you think of the intermittent fasting that's come out?
Sure, yeah. So intermittent fasting is another structured diet plan. It usually is someone's eating during a certain time frame of their day and then choosing not to eat during other times of the day. Common ways to structure this is like 16-8. So that means that you fast for 16 hours and then you eat for 8 hours. There's other versions of that, but that's probably the most common. For the right patient who enjoys this type of eating, I think it can be very helpful. They've seen, better diabetes control with this. However, there is an asterisk here. If you tend to be someone who, if you haven't eaten in a while, then you tend to either overeat portion-wise or you tend to choose foods you wouldn't normally eat because you're starving, then don't pick that. Like, it's just better for you just to eat regular meals in order to prevent that kind of overwhelmingly hunger feeling. So, but that's person dependent. Some people feel that way and some people don't. So you can always talk to your doctor, but you can explore that as an option if it's something you want to pursue. Go for it.
Is intermittent fasting, is that good for a person with cardiovascular disease or who has had a heart attack? Is it safe?
So I haven't seen a study specifically only looking at cardiovascular disease with intermittent fasting. Some of this is comorbidities too, I should have mentioned that. So if you are an insulin-dependent diabetic, there is some safety ramifications for intermittent fasting, and you'd want to make sure that you're essentially not going too low. If you're taking a short-acting insulin and not eating anything, that would be dangerous. So whenever you start a diet plan where you're wondering, always talk to your doctor, because then they can tell, they know your whole history, But I have not seen a specific study on intermittent fasting with the implications of cardiovascular disease. There's been quite a few with diabetes, and the relationship has been optimistic. And we know that diabetes, having better control leads to, better outcomes with cardiovascular disease, so we could infer that it's helpful. No, go ahead.
Back to the intermittent fasting, I had little problems with waiting that long because you have your morning pills.
Oh, sure.
And I did come across somewhere where for 50 and over in age, they can go 12-12.
Oh, sure.
That way they can get their morning meds in.
Oh, sure.
Better with a light breakfast and then, the 12 hours.
Sure, yeah. I don't know that I've seen the 12-12 as often, but yeah, I can look into it and see what the evidence shows. 16-8 is a common one. 20-4 is less common, but I'll see that. There's alternate day fasting too, where you eat maybe 2,000 calories some days and then 500 calories for 2 days of the week. So there's a lot of variations of it. And that's a good point. Having more and more studies is always helpful because then they can kind of tease out what's most helpful, what's absolutely necessary, what's not.
Close the kitchen at 7 o'clock.
Yeah. I mean, not eating late is definitely a helpful tool. Yeah. You want to eat most of your food when you're using most of your energy. So, yeah.
Now, we're both on amiodarone.
Sure.
Can you tell us about side effects from that?
Oh, amiodarone has a pretty long list of potential side effects. There's plenty of people who take it without issue. I don't know that I could reiterate all of them for you right here. We do have to monitor lung function, thyroid function. Those are probably your biggest kind of black box warnings when it comes to. Oh yeah. So it's worth visiting with your doctor and just, especially if you have some of those specific things. So yeah, it is, some of those older medicines, they just tend to be associated with a few more problems, so. But just because they're associated with problems doesn't mean that you technically have a problem, so. Yeah, good question.
It was mentioned here too that a CPAP machine is often used for sleep apnea.
Yeah,
Can you tell me whether that needs to be used all night long? Or according to the instructions on my CPAP, I have to use it at least 4 hours a night.
oh,
So if I use it for 4 hours and then take it off for my last 4 hours, is that okay?
sure. I haven't seen a study that's looked at cardiovascular events for 4 hours of use specifically. Generally, the better treated your sleep apnea is, the better off you are in terms of risk health. So, like for example, if you have mild obstructive sleep apnea, like 4 hours a day may be adequate to reduce your risk of the consequences of obstructive sleep apnea. If you have untreated, or if you have severe obstructive sleep apnea, then I would encourage like a full night of use, just because there's such a high correlation between that untreated severe sleep apnea and cardiovascular disease. Yeah. Good question.
Speaking of sleep, and I'm an old codger, I never used to have a problem, but in my old age, I find like one night a week I cannot get to sleep, and I hesitate to go for sleep helps for fear that it becomes a habit.
Oh, sure.
And so, what do you do then? Do you get up and walk around, or do you try other medication?
Yeah, sure. There, I mean, I'll always say, like, talk to your doctor, because if you're, like, getting up to void, like, 4 times a night, and, like, that's probably contributing to your sleep quality. So there can always be more details to this, but if a run-of-the-mill, once-a-week use of something like melatonin would, for most people, be pretty benign to utilize. So melatonin is that, like, hormone, it's like a drowsiness hormone that your body naturally makes. This would be, like, the supplement version of that. So something like that would be fairly benign.
So it does not interfere with other medications?
Always check with your doctor first so that it can look, for the most part, no, it's a fairly clean supplement.
Okay, it's tough to get old.
Yeah. Better than the alternative though.
Not bad sometimes.
No. There's pros and cons. What else?
Is neuropathy reversible?
So neuropathy is treatable, often not reversible. And then the goal a lot of times with diabetes neuropathy specifically is to prevent it from worsening. So we know that we can prevent it from worsening for most people if we get good blood glucose control. Yeah. And then there's medications to help manage, like specifically pain related to neuropathy, but none of them really restore sensation. So, at least not that.
Alpha-lipoic acid and
Yeah, so there's some small studies that show some benefit. Other larger studies don't show much of a benefit. You can always talk with your doctor about overall risk of trying something like that, but I don't think it's the end story for a lot of people. But for many, it may not be dangerous to try. What else? Okay.
Who would the Planet Heart program benefit? Like, is there
Yeah.
a certain age, or
Sure.
do the doctors recommend?
Yeah, sure. So I do try to bring Planet Heart up during wellness visits at least. I think it's 45, it might be the youngest for the cutoff for it, I'd have to double check. But yeah, if you've got family history of cardiovascular disease and you kind of want to know what's maybe more of, what's your number right now, you know, I think that can be helpful. It does screen for like some cardiovascular risk factors, so your cholesterol levels, your fasting blood glucose. So if you're not checking those in other ways, that might be a good way to get that information too. So yeah, essentially it's looking at that plaque buildup in various places in your body. So it's, I think, a fairly good test for people who are interested in knowing some of the information. Anything else?